Well, as you well remember, President Obama said it really over and over again. He said if you like your health insurance, you like the plan you have, you'll be able to keep it under Obamacare. That was loud and clear during all the discussion of health care. But now there's a disturbing new report out there that is suggesting that that may not be the case for a lot of employees. Now, according to this survey, which was done by a huge U.S. benefits consulting firm, they say that nearly 1 in 10 mid-size or big companies plans to stop offering health insurance to workers by 2014 when the key parts of that law kick in. I'm joined now by Pennsylvania Congressman Tim Murphy, who is the co-chair of the Republican Doctors Caucus. Congressman, good to have you here. Good morning.
Great to be with you again. Good morning.
So basically they're saying 1 in 10 checked off the box that said that they would drop coverage when this kicks in, when the insurance exchanges kick in. 1 in 5 said they're not sure what they're going to do when this happens. That's not good news for a tenth of the employees out there.
It's not, and actually those numbers may be underestimates because other firms that have surveyed businesses who have taken a careful look at the health care bill actually said that they're more likely to drop perhaps by as much as 50%, or maybe 80 to 90 million people will find themselves without employer-sponsored health care. The other big part of this news is there'll be changes in what employees get, either reduction in benefits or increased co-payments, increased premiums. And all of this, I think, is designed to do exactly what the bill planned to do, and that is to make private health insurance so expensive and so intolerable for employers and employees that people would go to the public option and go with the government plan. That was a plan all along, and I think that that plan is headed down the road pushing more and more people towards that.
Well, supporters of the plan say, look at Massachusetts. They say in Massachusetts, more employers started to offer coverage under that statewide health insurance plan over time. They believe that it worked to their benefit because it became law, basically, that people had to be covered.
Well, you have the mandate there, but you also have pretty high taxes in Massachusetts. And we are dealing with an economy here that still has very low unemployment, 14 million people out of work, 20 million people out there looking for work or for a different kind of job. And that's pretty frightening in an economy that just seems to not be able to get off of its back in this recession. What employers are going to be facing in the next couple of years are basically hundreds of billions of dollars in more taxes. People are going to see less in their paycheck as they're going to have other deductions taken out of for this disability insurance option, for other health care insurance as well. They'll see health care costs going up along with energy costs going up. And this is all part of the question I have, that when the president says if people have ideas about regulations that should be changed to allow more people to be hired, this is a big part of it. Right.
Yeah. We talked about that here a bit yesterday in terms of the regulations changes that they're making. Of course, none of those that they've suggested have anything to do with curbing Obamacare, which shouldn't come as a big surprise. The one other element to this, I think, is sort of the ripple effect, because the initial thing that made corporations start to offer health care to people was that somebody did it. So once Company A is offering you a health care plan, you're definitely going to be more likely to go over there and work than you would for Company B. So then everybody had to, across the board, offer health insurance benefits. The same could be true. Once some companies stop, other companies may say, well, if he's not doing it, we don't have to offer it either.
Well, it comes down to that point. That's a very astute point, Martha. It comes down to this point that employers are going to be taxed if they offer insurance, taxed if they don't, taxed if they will, taxed if they won't. And all those things are going to be more important. The point is this. The House has passed out of committee and out of the chamber a number of bills to make some changes in this to try and make it work. The Senate has said no. The White House has been virtually silent on this. And so the question is this any more a discussion of policy or of politics? What will really lead to changes that will allow businesses and private companies to compete to lower cost to provide better quality health care? And I think this is probably more at this point a political solution.
Congressman, thank you so much. Tim Murphy, good to have you with us today.
Great to be with you. Thank you.